everyone. We are reporting 3,590 new cases today. This is by far the highest number of cases we have ever seen during the entire pandemic. In fact, it's about 700 cases more than our previous high, which was just a few days ago. The virus is raging throughout the state of Ohio. There's no place to hide. We now only have 2 counties that are yellow, and they represent only 1/5 of 1% of our state's total population. So every county is red or orange. Only 5 of our counties are not high incident counties. So 83 of our 88 counties are high incident counties. Since there is no place to hide, all of us together have to come together to fight this enemy. We have to come together to fight this invader. We have tools to beat this virus back, and we've learned a lot during the pandemic. The tools are very simple. There's more people wearing masks, more people keeping distance, washing our hands, good ventilation when we're inside. We got to get back to fundamentals. We got to get back to the basics. I'm today calling on the leaders of each county, each community throughout the state of Ohio to come together to create a COVID defense team. This COVID defense team that we are asking every community to form is really what we need to fight back. It should certainly include the county commissioners, mayors, local hospital leaders, certainly the health commissioner, business leaders, religious leaders, and other local leaders. It should be in each county representative of the community. I'm asking the COVID defense team in each of our counties to assess and understand their situation, to inventory their assets in the community, and to focus on what steps to take to turn the situation in their community around. Because we now know what works to fight the virus, a major part of their job will be to explain to people in the community exactly what is going on in the community, the state of the virus, what's going on in their local hospitals, and what steps must be taken to slow this advance of the virus. And my team in the last 3 days and I have been doing our Zoom calls, starting with the counties that were high incidence counties, and now we've moved to the counties that are the highest number of cases in the last 2 weeks. We will continue to work down that list. I think that these calls, from my perspective, have been extremely productive. Each county has committed to expanding their working group to include more people. They've each committed to meet at least once a week. And they have each one a specific goal, reducing the active new cases that are coming in each day. And I just want to say I've been so very, very impressed by the leadership in these counties. So far, we have met with the leaders, some of the leaders in Clark County, Cuyahoga County, Hamilton County, Mercer, Allen, Putnam, Auglaize, and this morning, Holmes County. We will start again tomorrow morning with more counties. But we ask the counties not to wait for us, not to wait for us to schedule the call. It will take a few days, of course, for us to get through all 88 counties. But we ask people to go ahead, schedule your own meeting, put your own local leaders together. As one of the leaders said to me yesterday, if a tornado hit our county, and he said has hit our county, he said everybody rally together. We came out to help friends. We came out even if we didn't know the people. That's what we're asking communities to do again. Ohioans are great about this. I remember a few years ago, a lot of floods along the Ohio River. I was just so impressed that how many people came out to help their neighbors. Same way when tornadoes hit, people come out. This is a crisis that is grave, certainly, and much more widespread than those crises. So despite the grim data that we see today, that we'll show you in a moment, I'm optimistic because Ohioans have the tools. We know what works. We always rally when we need to rally. And I'm confident that people will do that. When people see a threat, particularly to their families, to their neighbors, to their community, they come together. We can, in fact, slow down this invader. The decisions each Ohioans make each day will really determine what kind of winter that we have. We must mask more. We must distance more. We must be more careful. We must wash our hands more. We must have more ventilation inside, particularly as we move more inside as winter approaches. We can control our own destiny. Eric, let's look at the numbers. As you will see, today we have, as I said, set another record. We report 3,590 cases. This is the first time we've surpassed 3,000 daily cases per day. To put that in perspective, today's new cases, our figure is about 25% higher than the second highest date, which we reported just last Saturday. It's not only the case numbers, though, that are increasing. We also have 192 new hospitalizations reported in the past 24 hours. This is the third highest we have ever reported. The top 5 highest new hospitalization numbers have all occurred in the past week and a half. So we continue to be very high. Let's look, Eric, at the next slide. This is all 88 counties reported by highest occurrence, starting with Putnam, all the way down Huron. What you see here in the blue, of course, are these the high incident counties. So as I said before, 83 of our 88 counties are high incident counties. And again, this is what the federal government, how the federal government determines it, 100 cases in 2 weeks based on 100,000 population. Let's go to the next slide. Again, this again tells us we have Putnam County at 9 times the high incident level. Auglaize is about 5 times. Holmes about 5 times, and you just all the way down, as you can see these top counties. The bottom of this 20th Greene County, it's about 3 times the high incidence. So we're seeing this in mid-sized counties. We're seeing it in small counties. And we're seeing increases in our urban counties as well.